This is my signature assignment putting together Telehealth Module 7. What is telehealth? What are the important aspects? Telehealth is the use of electronic information and telecommunication technologies to support long distance clinical healthcare, patient and professional health related education, public health, and health administration. The four main perspectives of telehealth are healthcare, patient provider relationship, policy, technology, and business. The visual down below represents a telehealth 2024 outlook. As you can see, 67% of Americans say that access to medical care is a problem where they live. 54% of Americans have had a telehealth visit. 89% of Americans who use telehealth services say they're satisfied with the service. 67% of Americans support legislation to expand patient access to telehealth services. Perspective number one is healthcare, the patient and provider relationship. In order to create a successful patient and provider relationship, telehealth providers need to incorporate multiple techniques into their business. Providers must make sure their voice is clear through the speakers and they are using a camera and that their background is not distracting. Before beginning the visit, ask your patients their comfort level about sharing sensitive health information with you. Along with that, prepare resources and tutorials to help patients safely use the telehealth platform. Providing guidance to your patients will help them feel more comfortable during the visit. Below is an image of the steps you need to take to set up a telehealth visit. First of all, call the pediatrician. Second of all, update your contact info. Third, get your documents ready. 4, download the app and test the link. And 5, set in a quiet room with well lit lighting. The second perspective is policy. Providers must follow and incorporate a few policies into their practice to ensure the privacy of their patients is protected. The U.S. Department of Health and Human Services demanded that telehealth providers must make reasonable modifications for people with disabilities, which may include making changes to their policies, practices, or procedures. The provider must also ensure that they provide privacy of protected health information, PHI, and recognize the importance of providing telehealth services in a private setting. If the setting is not completely private, providers must make sure they speak quietly and do not use speakerphone functions. They must also be HIPAA compliant, protecting the privacy of medical records, lab results, and personal information. The third perspective is technology. It is very important that telehealth providers have the appropriate technology needed for a telehealth visit. Providers need to make sure they have a properly working camera, reliable speakers, and an updated computer that allows them to have access to files. They must also have experience and practice with their technology. It is very important that the provider knows how to use their technology very well so they can run a successful telehealth visit. It is crucial that telehealth providers have a clear business plan and goal they want to achieve through their practice. Providers need to have a management plan. They need to figure out answers to questions such as who is going to organize and manage my program? They also need to consider pricing and promoting. What will you tell your clients your out of pocket prices? Will the insurance cover your practices? How will you advertise your program? You can survey patients to see what they would be willing to pay for out of pocket costs. How do they interconnect? All of these perspectives are intertwined because the stronger you are in one area will lead to more success in another. For example, you cannot build a meaningful patient provider connection without the right technology. If a patient can't hear you properly, how are you going to be able to form that connection? Let's say you don't have a clear business plan, then how are you going to ensure you follow the correct policies needed for telehealth? Overall, each of these four perspectives are equally important and build off of each other. Not being able to address one or more of these perspectives will ultimately lead to an unsuccessful telehealth program. These are the references I used in my presentation.